I think the title is very important. We've heard a lot about what's going on, good things in Jamaica by the previous speaker. And we've heard about successes in Medellin, in Trinidad Tobago, and in Honduras. So how come Jamaica is in the top 5 countries in the world in terms of homicide rates? And you've been trying to do these things for some time. And I've heard words used like it's intractable. I've heard words like transformation. I've heard words like monitoring and evaluation, sustainable planning, and collaboration. So what I want to do now, and you're going to hear me later on with examples of things that have been effective, some other cities than the ones that have been mentioned, some other examples than the ones that have been mentioned, is I want to give you an overview of how Jamaica can go from where it is now in the top 5 to being a country that is below 10 per 100,000. 10 per 100,000 is the epidemic level of violence, actually the epidemic level of any disease as defined by the WHO. And I'm going to do 4 things now. I'm going to reinforce not only the epidemic level of violence in Jamaica at the moment, but also its costs. Because I think one of the principal reasons for getting action by your government to move you from 4 times or whatever it is the epidemic level to below the epidemic level is money. And money that will bring in an increase in your GDP, very important. And yes, my reason for being here isn't your increase in GDP, it's actually to save lives and trauma and ensure you do die in peace. So I'm going to talk about that. I'm going to talk briefly about solutions because I'm going to be talking later about that. I'm going to be talking about what the cities did that actually reduced violence. And I'm going to be giving you a list of 5 things that you need to do, or you need to get your government to do, if you actually want to move to a country that has homicide rates below the epidemic levels. And one of these is raising awareness about what works. One of these is training. You can't make this thing happen without training the people in local government and, frankly, the people in national governments. Thirdly, you have to, if you're going to get into monitoring evaluation, you have to actually set targets. Somebody out there has SDG 17, Sustainable Development Goal 17, which is about partnerships. I'm glad Canada is one of your partners, and the IBD is one of your partners, and DFID is one of your partners. But it doesn't have SDG 16. SDG 16.1 is about reducing homicides and violence. And by 2020, you should have not only said, well, our homicide rate is whatever it is, 4 times the epidemic level, but you should have set a goal for 2025, in my view, a 50% reduction, because that would bring you down to the Chicago rate of 20 per 100,000. And by 2030, a rate below 10 per 100,000. And if you think that's impossible, then yes, Medellin was talked about, but you can look at New York City, and you can look at a number of other cities. Bogota actually is the inspiring city for the public health approach from the 90s. This is eminently possible if you decide you're going to do it. But you have to start managing to get there. And the 5th thing is money. You need to actually invest in these smart solutions. You can't achieve halving the violent crime on half measures. So in the introduction, somebody already gave you these incredible figures. Don't worry about them, they're scary. What those numbers mean are people getting injured, traumatized, dying. Some of this is short-term, but it's also long-term. If you're living in a community where people are getting shot, you're witnessing it. It's one of the adverse child experiences that was mentioned by the previous speaker. By the way, incarceration is another adverse child experience. You're losing economic development. You're losing economic development. I did some work with IDB, which is actually why I wrote the book that got me this invitation, and that is that portals don't solve the problem. You've got to actually get changes in government funding, and one of the ways to get that is to get them to focus on GDP and its benefits. Also, at your levels of epidemic violence, you're prone to what's happening in Mexico. You're prone to what's happening in Brazil. So you need urgently to do something about those levels of violence. Somebody earlier this morning said, well, the gangs were actually running some of the communities. I think this was in Honduras, but it's probably happening here. So this is urgent. And you also have to stop over-relying on a flawed and often failed system. And it's not only your system that's failing and flawed. Look at the North American system with unlimited money, $87 billion to incarcerate 20% of the world's prisoners. You've got to think about that. You can't think 87 billion, but it's several times your GDP. That's what the US spends on incarceration. And it spends a little bit more than that on policing. And Chicago, double the epidemic levels of violence. Or look at Baltimore, right next door to the White House, with a level of homicide higher than yours. So I wrote a book about the solid science. I'm going to tell you a little about the essentials for implementation that don't seem to be on your agenda, but I'm on the agenda, so it's on your agenda. We've got to look at those essentials. And getting buy-in also isn't on your agenda, but I'm here, so it's on your agenda now. So this is the solid violence prevention. These are portals. They're all portals. They're wonderful portals, but nobody uses them. So don't expect a portal to solve the problems. It may be part of the solution, but don't expect it to solve the problem. And the one in there that is the most important to me is actually the Washington State Institute for Public Policy, because it's about cost-benefit. You can get an incredible reduction for a relatively small sum of money. I didn't say the small sum of money you're investing at the moment. You've got to substantially increase from half measures to real investment. But the payoffs are huge. So there is what I'm going to talk about in the panel. And some of these were mentioned by the previous speaker. The first one is cure violence, which is what Trinidad and Tobago did. I actually prefer the British one, the youth inclusion programs, but they're the same idea, youth outreach. The second one are youth decisions. You help young men take smart decisions instead of stupid emotional ones. SNAP is a Canadian one, Stop Now and Plan, that is eminently adaptable here. Life skills is an American one, very well known, very highly proven. Fourth R is one reducing sexual violence, which is important, not only for reducing violence against women, but if you reduce violence against women, and you reduce violence in the long term, because young kids grow up watching violence, and that has quite an impact on them. Family support was mentioned. I'm a particular fan of the positive parenting program, but there are many types of programs that do this. My favorite, if you do nothing else in the next 100 days, you need to get an outreach worker into 10 emergency rooms across Jamaica. The impact of that is huge. When somebody comes in with a gun wound or a knife wound, you have a kindly outreach worker they can trust sitting there saying, do you really want to be killed? Do you really want to go to jail? Do you really want to be maimed? So do you come out in a wheelchair next time? That gets them to think. Not all of them, but it gets some of them to think. You have to change male norms. You have to get away from toxic masculinity. And yes, there is a role for smart policing. There is a role for proactive policing and even for some problem-solving policing. But thinking this is the solution, you will never get there. And you've proven that in this country, and the United States proves it every day, proves it every day. 25 people murdered every day in the United States. There's a mass killing in one of the ghettos, or in many of the ghettos in the United States, every day. So, the 7 essentials. These are really important. The first one is you need a National Violence Prevention Board. You can give it a different name, but you need a board that leads the transformation from where you are at the moment to where you need to be. You need this at the local level, in Kingston, in your other cities. You need it informed by those portals. My book actually helps you understand what these actions are, because if you tried going on these portals, you would be lost very quickly. You need to follow the standard planning thing. Diagnose the problem, mobilize the partners who can tackle it, implement, and that means training, you don't just guess it, and evaluate, You need to mobilize the sectors able to tackle causes, both locally and nationally. You need adequate and sustained funding. There are US cities that are miracle reductions. Boston, often cited. Boston and Bogota, by the way, were the inspiration for the now famous Scottish model, or the Glasgow model. And Boston had to reinvent itself 10 years later because there was no sustained funding. Once the gang problem went away, they dropped all the social investment. They didn't drop the police budget. You've got to train people up to standards. This means money. I'm speaking to the Canadian government. I hope that they will train people in cities in Canada. We have a province where every city has to have a plan. Any money for training? No. We've just elected a new government, and a priority in that new government looks as if it's going to be training. Well, we have trainers, and some of those trainers I think could be helpful in this country. You need public support and involvement. You know, why did Bogota work? Answer, mothers. Why did Boston work? Answer, mothers. Why did Glasgow work? Mothers. And why mothers? I'm not against fathers, but mothers actually go out and put pressure because they don't want their sons to choose between death, jail, coming out in a wheelchair. So they're motivated. The young men involved in these things aren't motivated. They don't care. There's no hope. So, some essentials for implementation. I mentioned them. The previous speaker gave you examples. I actually like Bogota and Recife, but Medellin is a good example. Honduras is an example where reforming the police resulted, and so they've got a long way to go, and they're worse than you, so I think there are lessons. Some US cities have lessons. Glasgow, that is often talked about, has low violence, but its model is, I think, particularly good. But you can do better than Glasgow, because Glasgow exists, so you can build on Glasgow. So I'm a great fan of the SDGs. And in simple terms, you should, in the next 5 years, be able to achieve these. It actually says 2030. So if I was the government, I would go for 2030, but I'm not the government. I know the data, and I know what the planning group should be saying. 5 years. Within 5 years, you should be able to save 650 lives a year. You should be able to stop 10,000 rapes a year, and actually probably more than that. And you should be able to stop 250,000 kids from suffering some sort of violence, and it was mentioned the previous speaker. So, prevention is eminently affordable. I didn't say it has no cost. It's eminently affordable. If you next year could get 10% of what Jamaica is spending on policing into the actions that are effective, then you will achieve a 50% reduction. Now, you have to spend some money on the planning. This says $1 per citizen because I couldn't work out how to work out in your money what it would cost. But basically, for every Jamaican citizen, you should be investing the equivalent of a McDonald's coffee. So I don't know what that is, but that's not a lot of money. And that's how much you need to spend on planning, setting goals, training, bringing those planning groups together. And then separate from that, you should be spending 10% of what you're currently spending on reacting to crime. That's what police and prisons do. They react. They react. They don't react actually that well. The clearance rates in somewhere like Chicago for homicides are well below 50%. So I can't imagine what they are here. You should never be relying on the American more policing, more prisons model. It just doesn't work, and it will never work for you. I didn't say there shouldn't be accountability, but don't rely on spending on the wrong things. So I've talked about savings. Down there in the economic benefits is 3% of GDP. I think your GDP is $14 billion. I actually think you can achieve much more than 3%. It's just that the World Bank figures and other sources you use play around with different figures. I think 3% is very conservative given your violent crime rates. So you use the science, you use those 7 essentials, you fund, and you get the benefits. It's simple. It is simple. It's hard to do. So here is my list of things that I would like to see the planning board, and actually I'd like to see your government adopt as priorities for the next year in order to be the decisive actions now that will reduce violence by 2025 and bring you down to below epidemic levels by 2030. The first is make people aware of what works. So the previous speaker gave you some examples, and there were very good examples, and there are more examples. Show them that it's possible. Medellin, if you like Medellin, I like other cities, Sao Paulo. There's cities even in Mexico that have got large reductions. It's possible to get large reductions. 2, train the human talent. And there are 2 sorts of human talent. One are the planners. So you have a planning agency, but you have to spread that across the country. You have to spread it into different departments. You have to enable planning that brings the different national agencies together and brings those national agencies together locally. The other are the implementers. Don't expect cure violence or youth inclusion programs or positive parenting programs, whatever are your favorite programs, to work if you don't train people. You have to train people. 3, you have to have national and local prevention plans that diagnose the causes. You know some of these causes, risk factors, whichever phrase you like to use, but you need to be more sophisticated about that. You need to use mapping, and mapping of social deprivation, social problems, and superimposing those homicides and violence on top of those. And the tools exist. The Americans have invented these tools. They just don't use them. They use them for hotspot policing. Hotspot's okay, but you won't reduce your epidemic levels of violence on hotspots. You've got to start using the social data. And by the way, the social data is often used to help the police target in Chicago or whatever city is not being that successful. Philadelphia is just beginning to use these sorts of mapping. And You need to identify goals. I've mentioned this, goals for 2025 and 2030. And these are outcome goals, outcome goals, outcome goals. Not just how many people did you train or how many parents got training. These are actual real reductions in measurable violence. Homicide is the most easily measured. I'd like to see you measuring violence against women. You have to use the CDC survey on intimate partner and sexual violence survey. I hope you can get funding from USAID or from somebody to do that. Other countries in Africa are now using some of those tools, so why not in Jamaica? And the fifth is sustained investment. And as I say, roughly 10% of what you're spending on policing, which is a starting number. And whether you get to it next year or the year after, you have to get to it in the next 2 years. And any increases in funding for policing or for courts or for prisons absolutely must be matched by increases in funding for the actions that are going to be effective. Any increase in the security budget or the classic security budget must be matched by increases in funding for what works. So very briefly, I'm aware I'm just running out of time. I would like you to become part of an international movement. You may already be in this. I've just been in Latin America talking with 17 countries, and they are getting very interested in those same 5 things. There's a Peace in Cities campaign that is actually having a meeting in Geneva today. You should be part of that. Your cities should be part of that. I'm going to a meeting next week of faith-based organizations, incredibly powerful in terms of lobbying governments. UN Habitat is meeting in Guadalajara, Mexico in December. You should be there. And you should particularly be at the UN Congress in Kyoto in April 2020. But you shouldn't just be there to listen. You should be there to say, well, in Jamaica, we have actually taken 5 steps that will make a difference to violence in our country. And our target for 2025 is 50% fewer homicides. And we aim to be sure of reaching that by 2030. Thank you so much for listening.